Well, the preliminary guidance document of the College of Family Physicians of Canada I think it was 2014, recommended a maximum dose of THC 0.9%, 400 milligrams per day. And the reason why they gave that maximum is that was the maximum dose used in controlled trials. And that seemed to have fairly modest effects on cognition and other harms, and yet it was effective in treating neuropathic pain. So that's the dose that we recommend, 400 milligrams and 9% THC, and with at least equal amounts of cannabidiol. And again, it's very concerning that cannabis physicians and the producers and spokespeople for cannabis, pro-cannabis advocates are claiming that much higher doses are fine, such as 3 grams. 3 grams is 6 joints a day. It's not fine. It can be very, very impairing, especially for people who shouldn't be smoking cannabis in the first place. There's no question that vaporization is safer than smoking. Smoking produces hundreds of products of combustion, chemicals, organic chemicals that are carbon chloride based and so on, that are very dangerous, that have been linked with cancer, with lung cancer, and also with cardiovascular disease. And vaporizing eliminates almost, not quite, but almost all of those harmful chemicals. So if one is going to use marijuana, vaporization is definitely preferred. In terms of driving, the effects of cannabis on psychomotor performance can last up to 6 hours or longer. So we recommend not driving for at least 6 hours after using marijuana. Furthermore, we recommend vaporization. We recommend trying to titrate the amount of marijuana smoke you inhale so that you don't need to get completely stoned and intoxicated on cannabis. So for example, avoid breath holding, which means to take in a large amount of marijuana smoke and keep it in as long as possible. Just take a few puffs and stop when you're starting to feel, pleasantly intoxicated. And so we recommend not combining marijuana with alcohol or other psychoactive substances, because that can increase the risks of accidents and other harms. We also recommend non-daily smoking. People who are smoking large amounts every day probably have a problem if they're using it so-called recreationally. So we recommend limiting it to no more than once or twice a week. Other amounts, if you're going to use oral cannabis, don't take large amounts at once. It's quite kind of seductive in a way. You take a big brownie containing several grams of marijuana. You may feel nothing for a little while, but then as it absorbs, it can cause quite a toxic reaction. So be very careful about using edible products.